Welcome to the AEHR video training series presented by the Information Technology Education Department at UK Healthcare. This course is intended as initial AEHR training for residents. This video is video number 3 in a series of 4 and is divided into a series of 5 chapters. This first chapter will introduce you to the process of documenting a patient visit in a note in AEHR. In this chapter, we will discuss methods for documenting the HPI, review of systems, physical exam, assessment, and treatment plan, among other topics. Every clinic has its own set of unique notes. This video will discuss the basics that should be included in most notes. It is advisable for you to review the clinical summary document that is printed out and given to patients at the end of their visit in the clinic that you are working. Any information listed on this clinical summary document will need to be completed in your note before the patient leaves the clinic. This way, the patient will receive a full clinical summary upon exiting the clinic after their visit. Remember from a previous video that in this example we are documenting a note for a patient complaining of polydipsia. When we created the note, we identified the chief complaint of polydipsia on the note selection screen. Now, from the Note tab, you can see that this basic internal medicine established patient note is set up with polydipsia listed in the chief complaint section. There are 2 ways to add a chief complaint to a note. One is to add the chief complaint when creating the note, as we did with polydipsia. If you wish, you can also add a chief complaint from within the note. To do this, click the Chief Complaint button on the clinical toolbar. Press the CC Plus button on the clinical toolbar now. Then you can search for the additional chief complaint that you wish to add. Click the checkbox to the left of the item and then click the OK button. There will now be 2 chief complaints listed in the note input area. Some notes will allow you to free text chief complaint information rather than searching for them in the ACI. The benefit to searching for chief complaints in the ACI is that it will add an HPI form specific to that chief complaint to your note. HPI forms are automatically generated for all chief complaints that are added prior to creating the note. This is why polydipsia has its own HPI form in this note. There may also be HPI forms generated automatically as part of the note structure without a chief complaint being necessary. An example of this would be diabetes automatically appearing as an HPI form in an endocrinology note. If a chief complaint is added after the note is started, it is necessary to use the Recompile button at the bottom of the note authoring workspace in order to generate an HPI form for that chief complaint. In order to document the HPI, if a complaint-specific form is listed, use the Yes and No options to the left of the items in the HPI section. When using these buttons, if you select one option and mean to select the other, click on the other option to switch the selected choice. If you select Yes or No but mean to select nothing, simply click on the selection you have made a second time to turn it off. Notice that just by clicking the Y button, a full sentence has been generated by the system in the note accumulator. Once this is done, you have multiple ways that you can document more information about the symptom. Free texting is available by clicking the gray rectangle in the note accumulator and typing or dictating with Dragon. You may also click the bubble to the right of an item. Click the bubble to the right of polydipsia now. This will give you more radio buttons, yes and no options, checkboxes, and additional free texting space to allow you to elaborate on the symptom. When you click the bubble to the right of a complaint, the details screen that appears has many options available for you to use when elaborating. Although there are many available options on this details screen, you do not have to select an answer in each section. You are able to fill in only the information you need and want included in your note. Anything extraneous can be omitted. There is also a free texting area at the top of the details window. Once you have entered all of the additional information about a complaint, click the OK button. In the note input area of the note authoring workspace, you will notice that there are also associated symptoms that will appear below the complaint forms in the HPI section of your note. You may document those if you wish, but it is not necessary. Sometimes things will appear as associated symptoms that you would like listed as their own complaint. Either option is acceptable for you to use. The only difference between elaborating on a complaint as an associated symptom symptom or in its own HPI form is the wording of the information within the note. In a previous video, we discussed how it is possible for you to review the patient's history information by using the note tabs across the top of the screen. You may also choose to view this information from within your note. On the table of contents, you will find sections of your note devoted to active problems, past medical history, surgical history, current medications, allergies, and immunizations. These are all areas that can be viewed and edited from the note tabs. When moving to different sections of your note, remember that it is beneficial for you to select the area you wish to move to by clicking on it on the table of contents. This will allow the system to close other sections of the note and focus only on the section that you are working with. The clinic staff will typically enter family history information as part of the intake for the patient, but you may need to add additional items during the course of your conversation with the patient. To add a family history item, click the Problem tab on the clinical toolbar. Then click the Family History sub-tab. When you are adding a family history item, you will need to first select the family member and then select the problem. In this example, we'll say that our patient's paternal grandmother has diabetes. So first, select paternal grandmother, then search for diabetes. It's possible that the patient may not know the type of diabetes or any potential complications that their grandmother may have had. Because of that, there's always a generic option available in family history. Clicking anywhere on the line except over the notebook selects it. Click OK to exit the ACI and return to your note. Sometimes history items will appear on a patient's chart that you do not want to appear in your note. In order to keep a problem on the patient's chart but remove it from your note, simply click to highlight the problem, then click the Hide button. The text will then appear grayed out, indicating that the item is still on the patient's chart but will not appear in your final note. This button is available for all history items. If you wish to hide an entire history section, simply click the Hide All button in that section. That will hide the entire history section from your note. The Show and Show All buttons will reverse this action and allow items previously hidden to be viewed as part of your note. In most clinics, the only social history item that is added to the patient's chart by the clinical staff is smoking status. If you would like to, you can add other social history information, including travel history, marital status, alcohol use, exercise habits, household members, and many other topics. To add a social history item, click the Problem button on the clinical toolbar. Then click the Social History sub-tab. Search for the item that you wish to add, and then click anywhere on the line for that item that you wish except on the notebook icon. You have an option to add as deny any social history item. This will identify that the patient denies doing that specific social history item and will display in the patient's chart and in your note under a denied heading. To add a social history item as deny, simply right-click the item and select Add as Deny. Click OK to close the ACI and return to your note. It is always a good idea to regularly save your note as you are working on it. When you click the Commit button on the clinical toolbar, you are saving the information that has been added into the patient's chart using the clinical toolbar or the ACI, including any history information and chief complaints. However, it will not save any information entered directly into your note, like the HPI or free texting information. In order to save both the information added from the clinical toolbar and the information added directly into the note, click the Save button in the lower right-hand corner of the note authoring workspace. Click that button now. This will save the information in the note for you, and then it will click the Commit button in order to save the information to the patient's chart. There is a button to save and close to save the note and then close it. However, if your note is not yet finished and you click this button, then the patient may not get a complete clinical summary when they leave the clinic. When you click the Save or Save and Close button, the system will automatically click the Commit button for you if it is needed. Simply click the Save and Continue button when it appears to save that information as well. The Review of Systems section of your note may be documented using the radio buttons next to each system. You may also wish to document all of the systems as normal and then document abnormal information by exception. To mark all systems as normal, simply click the All Normal button in the upper right-hand corner of the Review of Systems section of your note. Click the All Normal button now. Then, if you would like to document exceptions, simply click the Abnormal button next to any systems that you would like to change. If there is a system that is selected when you click the All Normal button that you do not want to be documented at all, simply click the selected negative radio button to turn that option off. Note that there are bubbles to the right of each option, so you may document more information about any system that you wish. You may also free text additional information in the Additional Details bubble or in the note accumulator at the bottom of your note authoring workspace. The Vitals section of your note will only show vital signs and measurements entered today. If you wish to see a history of vital signs, you must click the Vitals tab at the top of the note authoring workspace. Typically, the clinical staff will add vitals to the patient's chart for today's visit. However, if you need to add a vital sign like an additional blood pressure reading, all you will need to do is click the heart icon on the clinical toolbar. Any vitals that you add will appear in the Vitals section of your note. When you are documenting the physical exam for the patient, you may notice that there is an All Normal button available in the upper right-hand corner of the section, just as there was in the Review of Systems section of the note. However, it is not recommended that you use this button for this section of the note. It is very important that you only identify what you have actually examined. Because of this, it is recommended that you document each body part you have examined individually rather than using the All Normal button. You do have a few options for how to document the physical exam on your note. You may choose to select options using radio buttons, yes and no buttons, check boxes, and other options, including free text space, located in the Additional Details window that appears when you click the bubble to the right of Normal or Abnormal. If you prefer, you may also free text the physical exam findings by either clicking the gray rectangle in the note accumulator and typing, or using drag in to dictate your findings. Some notes may also have a large free text box available for documenting the physical exam. The assessment is what you are diagnosing the patient with during today's visit. Assessments are used when the billing for today's visit is calculated. There are 3 ways to assess a problem for a visit. If you are seeing the patient for a previously diagnosed problem, then it should already be listed in the assessment section of your note as an unassessed problem. To assess this problem, simply click the icon of a notebook to the left of the problem to move it from unassessed problems to assessed problems. Some notes will have a list of commonly assessed problems associated with that type of note listed below the assessment portion of the note. If you are assessing the patient with a new diagnosis during this visit and the note you are documenting into has these options listed, you may select a diagnosis by checking the checkbox to the left of the item. To add a previously unassessed problem that is not included in the checkboxes below the assessment box, click the Problem button on the clinical toolbar. Click the Problem button now. Search for the problem in the Active tab of the ACI. Once you have located the problem, click the Notebook icon to the left of the problem to both add the problem to the active problems list for this patient and assess the problem for today's visit. If you click anywhere else on the line with the problem on it, then the problem will be added to the active problems list in the patient's chart, but it will not be assessed for today's visit if you do not click the Notebook icon. The Discussion Summary section of a note is where you can document discussions with or instructions given to the patient. Orders are placed and medications are prescribed in the Plan section of the note, but the Discussion Summary section of the note is a great place to document things like lifestyle changes, including diet and exercise tips, or suggestions for when the patient should call for a PRN visit. Some notes will guide you through the documentation of this section using checkboxes, radio buttons, and free text boxes. However, in many notes, this is a free text-only field, making it a fantastic place to use drag and to dictate rather than type if you choose. The Plan section of the note is where you will document your plan for helping the patient with today's assessed problem. This is where you'll place any orders that you want completed, prescribe any medications that are needed, order immunizations, order consults with other areas, and place orders for follow-up appointments. Any medications that you may have renewed, continued, discontinued, or completed while on the Meds tab of the Note Authoring workspace will show here with identification before them. Details on placing orders and prescribing new medications will be covered in much more detail later in this video. The Counseling section of the note is where you will document the amount of time that you spent counseling the patient for billing purposes. You will also also documented who you counseled and what you counseled them about. Simply check the boxes to identify who you counseled and what you counseled them about. You will also need to enter the duration of the encounter and how much of that time was spent counseling. That information will be used by the billing personnel to determine how to best bill the patient for this visit. It is important to remember when you are done seeing a patient that you must change the status so that the checkout staff, nursing staff, or whoever is going to be next to see the patient knows that you are done and the patient can move on to their area. To change the status, use the status drop-down located on the clinical toolbar to identify the next stop for the patient. Remembering this step will keep the patient flow moving smoothly and quickly. This chapter will discuss necessary steps for prescribing a new medication in AEHR. This chapter will discuss available methods for prescribing, including e-prescribing and printing prescriptions. Finally, we will discuss replacing an ineffective medication so that the system documents that the old medication did not work properly for the patient. In the plan section of your note, you may wish to prescribe a new medication for the patient. In a previous video, we discussed how to review and renew, discontinue, continue, or complete a patient's current medications. Now we will look at how to add a new medication. To prescribe a medication, click the Medications button on the clinical toolbar. Click that button now. This will open the RX subtab of the Orders tab of the ACI. Notice that this is different than the Med History tab that we looked at earlier. Med History will allow you to add current medications that the patient is taking, while the RX subtab will allow you to prescribe a new medication. If you want the medication to be prescribed, make sure that you are on the RX subtab. If you search for the entire medication name rather than just a portion of the name, then the system will display options for the medication you have searched for as well as generic alternatives. This will give you options to select from when deciding what medication you wish to prescribe. When you search for a medication, you will notice a series of icons to the left of the medication names. These icons will help you to identify whether or not the patient's prescription insurance plan will cover the medication you wish to prescribe for them. The prescription insurance information is typically entered by the clinical staff during the intake process for the patient. If this information has been entered, then you may see these icons next to medications. A green smiley face indicates that the medication is on formulary with the patient's insurance, meaning that it will have the lowest copay for the patient. A yellow neutral face indicates that the medication is on formulary with the patient's insurance, however, a higher Tier 2 copay may be required of the patient. A red sad face indicates that the medication is off formulary for the patient's insurance, indicating that they will have the highest copay amount for that medication. You may see an icon of a circle with a slash over a $sign indicating that a medication is not paid for at all by the patient's insurance. It is also possible that you will see a PA icon next to a medication. The PA icon indicates that prior authorization is required for that medication. Finally, over-the-counter medications will display with an OTC icon next to the medication. If you do not see these icons next to the medications you are entering, then it either means that the patient's prescription insurance information has not been entered by the clinical staff or that the patient does not have prescription insurance coverage. Once you find the medication and dosage that you wish to prescribe, click the checkbox next to it to select it and open the medication window. Here you can identify additional information necessary for the prescription, like the SIG, the number of days supply the patient will receive, the number of refills available for the medication, and how you wish to send the prescription. Any fields that are highlighted in yellow will require additional action from you before the prescription can be successfully submitted. Anything in yellow in AEHR identifies that action from you is required. You may choose to link a medication to an active problem if you wish, but it is not required that you do so. Linking a problem to a medication will make it easier to identify everything, including medications used to treat an active problem. Therefore, linking a problem to a medication is recommended, but not required. The next step in prescribing a medication is identifying how you would like the patient to take the medication by selecting a SIG. There are 3 ways that you can enter a SIG for a medication. All 3 ways are identified by radio buttons located above the SIG entry box. Personal will show the standard ways that the medication is prescribed. Once you have prescribed this medication, the exact way that you prescribed it will also display in this list for you to select the next time you prescribe this medication, whether to this patient or another. The new structured option will allow you to select a non-standard SIG using a drop-down options to identify how many pills you would like the patient to take how often. Finally, the new free text option will allow you to free text the SIG. This is particularly helpful for medications such as a Z-Pak that have inconsistent dosages or for medications that require titration. Once you have selected a SIG, you will notice that the quantity section is highlighted in yellow. However, if you have used a personal or new structured SIG, then you can fill in the number of days that you wish for the prescription to cover, and the quantity of pills will automatically complete as well, which will save you from having to calculate the quantity of pills yourself. Don't forget to enter the number of refills that you wish for this prescription to have included with it. Then you will need to select an option from the Evaluate drop-down box. There are 3 available options in this drop-down. Complete will automatically move the medication from the current meds list to the past meds list when the prescription is completed. The completion date will be listed here for your reference. This will be helpful for medications that should not need refilled, like antibiotics. The Evaluate option is used for most maintenance medications. When the medication is complete, an alert will appear on the clinical summary screen and a task will be created and sent to refill text for your clinic. The Renew option is rarely, if ever, used. This will not automatically renew the medication, but instead will display an alert on the HMP screen to let you know when the medication is completed. If you would like for this medication to be dispensed exactly as you have written it without a generic being substituted by the pharmacy, then make sure you check the DAW checkbox. You may include any additional notes for the pharmacy in the pharmacy instructions area in the additional details section of the medication window. The next step is to determine how you want this prescription to be submitted to the pharmacy. The meaningful use preferred method of submission is e-prescribing so that the prescription is electronically delivered to the pharmacy. This can be done by selecting Send to Retail from the Submission Options drop-down menu. This will then allow you to select from the pharmacies that have been entered for the patient. Typically, pharmacies are entered as part of the intake process for the patient. There may be up to 4 pharmacies listed per patient, so be sure to ask the patient which pharmacy they want to use when you complete the prescription. If you need to add a pharmacy for this patient, then you may do so by clicking the binoculars and searching for the pharmacy that they want to use. Send to Retail is the default value selected for most medications. Another option that meets meaningful use requirements for e-prescribing is to use the Send to Mail Order option. This option will send the prescription to the patient's preferred mail order pharmacy. In AEHR, mail order pharmacies are treated exactly the same way as brick and mortar pharmacies are. So if you need to enter a mail order pharmacy for a patient, you can click the binoculars just as you did to select another pharmacy in the Send to Retail option. Use the Call RX option to identify that the prescription has been called into the patient's pharmacy. Using this option does not meet meaningful use prescribing requirements. If you are working in a clinic that dispenses samples, you can document that a sample is being distributed to the patient by selecting the Dispense Sample option. When this option is selected by you, it automatically generates an Orders Pending task for the clinical staff. This will allow the clinical staff to document how many samples were given to the patient. The Print RX option is used to print a prescription. Controlled substances cannot be legally e-prescribed, so if you are prescribing a controlled substance, the default value will be Print RX, and Send to Retail and Send to Mail Order will not be available options for that medication. When you select Print RX, the prescription will be sent to the prescription paper that is kept in a locked drawer of your clinic's printer. If the patient uses a pharmacy that is not yet accepting e-prescriptions, you may want to select the Print RX option and give the paper prescription to the patient. The Record option is used to electronically record a handwritten prescription. This is only used to document prescriptions that you had to handwrite because the system was down. When the system comes back up, those prescriptions will need to be added to the system so that they are included in the patient's electronic medication history and are used for drug interaction checking. Finally, when prescribing a medication, it is important to be sure that the provider names under the additional details section on the prescription are correct. The ordered by name should auto-complete with your name as because you are the provider who is ordering the medication. When you take your assessment test after completing this training session, your signature will be electronically captured. This is so that when you prescribe medications, your signature goes with the prescription either electronically or on a printed prescription. This must be done before you can prescribe in AEHR. The Managed By field should be completed with the name of the provider who is primarily responsible for managing the patient's care now or in the future. So if provider A is the patient's normal provider, but provider B is covering for provider A while they are on vacation and prescribing medication for the patient, then provider B is the ordering provider and provider A is the managing provider. Finally, the Supervised By field should be completed with the name of the ordering provider's supervising attending if they have one. Once you have fully completed the medication window, click the Save and Return to ACI button to return to the ACI and enter more orders, or Save and Close ACI if this is the last order that you are entering for this patient right now. You will then see that the new medication appears in the plan section of your note with an indicator that the patient should start the medication. E-prescriptions are sent to the pharmacy and printed prescriptions print out when you commit and save the prescriptions. If a patient has been prescribed a medication that turns out to be ineffective for them, or if they discover that they are allergic to a medication, it may be necessary to discontinue one medication and start the patient on a replacement medication. This can easily be done in AEHR in a way that will document that the new medication is replacing the old medication. In order to replace a medication, click the Medications button on the clinical toolbar and search for the new medication. Complete the prescription information for the new medication. Once you have completed all of the necessary fields for the new medication, click the Replaced drop-down menu under Additional Details. From here, you can see a list of all of the patient's current medications. Select the medication that you are replacing with the new medication. If you wish, you can scroll all the way down to the bottom of the medication window to add more information about why you are replacing the medication in the Annotations section. Click OK. Doing this process will discontinue the old medication and move it to the past medications list. The new medication will appear under the current medications list. This third chapter will discuss placing different types of orders in AEHR. In this chapter, we will discuss placing lab, radiology, procedure, follow-up appointment, consult, instructions, immunizations, medical supply, and medication administration orders. Clicking the beaker icon on the clinical toolbar will open the ACI to the Orders section. However, if you are adding multiple items to your plan, like a prescription and an order, it is not necessary to exit the ACI window. You can instead simply click through the subtabs, add all of the items that you need to add, and then exit the ACI window. There are many types of orders that you may wish to place for a patient, including lab orders, radiology orders, referral orders, and follow-up appointment orders. This video will review each of the different types of orders that you may wish to place during a patient visit. Lab orders are any orders requiring specimen samples that will undergo laboratory tests. Some of these tests will occur in the Kentucky Clinic lab or in one of the hospital labs, and some of the lab tests you may order will occur in the clinic. Both types of lab tests are ordered from the same place. If you are ordering a lab test that will occur in the clinic, search on the Lab subtab of the Orders tab for the term POL. POL stands for Physician Office Location, meaning that the test will occur in the clinic rather than in the lab. Some examples of POL tests include urine microalbumin, rapid flu tests, or PT-INR tests. Not every clinic has POL tests available, and not every clinic has the same POL tests available. So always be sure that your clinic offers a test before you order it. If you are searching for a lab test that will take place in the lab, simply search for the name of the test. Lab tests must be linked to a problem. It is possible for you to select the problem after placing the order. However, it is faster and easier to first select the problem on the left side of the ACI and then check the checkbox to the left of the order that you wish to place. For this patient, let's click to select the problem first and then click the order. Click the problem now. Now click the checkbox for the order. This will automatically link the problem to the order in the system. If you do not first select a problem, when you click the checkbox for the order, a window will open asking you to link the problem to the order from the Order Details window. Once an order is placed, if you wish to edit that order, right-click the order and select the Edit option. Select the Edit option from the right-click menu now. Editing an order will allow you to change things like the location where the test will be done, the date the test will be done, or the problem that the order is linked to. Radiology orders are placed in the same way as lab orders are. However, instead of searching for radiology orders in the Lab subtab of the Orders tab, you will instead use the RAD subtab of the Orders tab. If you are searching for MRIs, search using the term MRI. If you are searching for CT scans, search for the term CT. If you are searching for ultrasounds, search for the term US. However, if you're searching for X-rays, do not search using the term X-ray. Instead, search by body part. So searching the term chest will show all chest x-rays, while the term CXR only shows the most popular chest x-rays. Like lab orders, radiology orders must be linked to a problem. They can also be edited by right-clicking over the order and selecting Edit. In AEHR, procedures are orders like sleep studies or ECGs that are not lab or radiology orders. Those can be ordered from the Procs subtab of the Orders tab. You will place these orders in the same way that you did lab and radiology orders. If you wish to have the checkout staff schedule a follow-up appointment with you for this patient, you can place a follow-up order in AEHR that will be delivered directly to the checkout staff to schedule when the patient leaves the clinic. To place a follow-up appointment order, use the Follow-ups and Referrals subtab. You can search for the word follow to find all available follow-up time frames. If there is not a follow-up available for the time frame that you need, select the follow-up option and free text the specific date or time frame when you want the patient to return. Consult or referral orders can also be placed from the Follow-up and Referrals tab. If you search for the word consult and then hit the Enter key or click the binoculars, then the system will return all of the available areas to consult with. Consult orders will always open a details window asking for more information when they are selected. Every consult order will require you to complete the clinical indication question identifying why the patient is being referred to this area. Some areas, like cardiology, require that you answer multiple questions before placing a consult order. Any questions that you need to answer will be highlighted in yellow. If you wish for the consult to take place on a certain date or with a specific provider, you can enter that information from the Additional Details section of the Order Details screen. You may choose to place orders for Krames documentation to be given to your patient. Krames is a website used by UK Healthcare to print out patient education sheets. If you order an education sheet in AEHR, then the clinic staff will print the documentation and give it to the patient. AEHR does not link directly to Krames, so if you would like to preview the Krames documents, you can access Krames from CareWeb by clicking on the link on the right-hand side of the website to Patient Education. Once you are familiar with the documentation that you wish to have printed for the patient, use the Instructions subtab of the Orders tab of the ACI to search for that documentation. Like other orders, you will need to link this documentation to a problem. So click the name of the problem on the left side of the screen, then check the checkbox to the left of the document that you wish to order. Placing this order will send a task to the clinic staff to have them print and distribute the education sheet to the patient. If your clinic administers immunizations in the office, then you can place orders for these immunizations from the ACI. Under the Immunizations subtab of the Orders tab of the ACI, you can search for the immunization that you wish for the staff to give the patient in the office. Immunizations are typically linked to health maintenance, though they do not have to be if it's more appropriate to link them to another problem. Once you've linked the order to an appropriate problem, check the checkbox to the left of the problem to place the order. The Supplies subtab will allow you to place orders for diabetic testing supplies, boots, cath needles, and other medical supplies. You may place orders for these items in the same way that you have for the other orders. If you wish for the patient to have a medication like a B12 shot or a testosterone shot administered while they are in the office, click the Med Admin subtab under the Orders tab of the ACI. Placing an order here will create a task asking the nursing staff to administer the medication to the patient while they're in the clinic. You can search for a medication to have administered in the same way that you've searched for the other orders. Link it to a problem and then click the checkbox to place the order. If the order details screen opens, you will need to complete any fields that are yellow. Clicking OK will close the ACI and return you to your note, where you can see that everything we just added is now in the Plan section. All of the types of orders we just discussed are transmitted to the appropriate areas for completion when you click the Commit button and save the information to the patient's chart. This fourth chapter will discuss completing a note. In this chapter, we will discuss how to cite results into your note, document procedures, and complete an attending attestation. Finally, we will discuss viewing and signing your note when it is completed. On occasion, you may receive either a passive or active contention alert while you are documenting. The passive alert will occur when someone else is editing an item that you are trying to open for editing. This alert will let you know that another user is editing this item. When you see this alert, you should close the item to avoid contention. Another alert you may see is an active contention alert. This will appear if you choose to continue your own documentation while the other user is editing the same area of the chart. This alert appears after the other person saved their edits first. When you get this error, you will need to either cancel commit and view the changes made by the other user, or discard changes, which will discard the changes listed in contention but should not lose any other data. Finally, you may see a note contention alert if you try to open a note for editing that someone else is currently editing. This alert will let you know that you can view the note, but you cannot edit it until the other person is done. Any tests that are completed during the current encounter, for example, POL tests done during today's visit, will automatically cite into your note for you. However, if you wish to pull the results from a test done on another day into your note, you may do that using these steps. Click the Results tab on the Note tabs at the top of your note authoring workspace. Do that now. Right-click over any results shown on this tab. Select Advanced Results Citation from the menu that appears. Select that option now. You will then see all of the patient's results. Check the checkboxes next to any results that you wish to add to your note. Then click OK. Return to your note by clicking on the Note tab. Click the Note tab now to return to your note. You will now see that the selected results are now included below the Results section of your note. If you participate in performing a procedure on a patient while they are in the office, then you will need to document that procedure in your note. Clinics that frequently do procedures may have notes that are pre-populated with procedure forms. If you are using a note that does not have a procedure form that you need pre-populated, then you need to add the form. To add a procedure form, right-click over the word procedure on the table of contents. Select Add Form Top from the menu that appears. The list of available forms that appears will default to your specialty, but if you wish, you can always select another specialty from the clinic drop-down at the top of the screen. Click the checkbox next to the procedure that you are performing and click OK. A form will then appear in your note that you can complete with information about the procedure. Once completed, this information will appear on your finalized note. There is a section at the bottom of every note for an attending attestation if it is needed. Your supervising attending will click the bubble to the right of the appropriate option and fill in the correct responses. Attending physicians are able to finalize notes created by residents once they complete the attending attestation and sign the note. The note should also be signed by the resident who documented it. The signature section of the note will display the names of anyone who has already signed the note. Once you have completed documenting your note, you may wish to view the finalized note before signing and closing it. To do this, use the Viewing Options section of the note authoring workspace. Check the box next to the letter option if you wish to view it as well as the note. Click the View button now to view this note. This will open a print preview version of your note where you can make sure it looks the way you would like it to. To return to edit your note, click the Close button. Click the Close button and return to your note now. now. It is always a good idea to save your note one final time before signing it. Remember that clicking the Save button will save both the note and the information for the patient's chart. When the encounter summary appears, be sure to check the Meaningful Use alerts at the top of the screen. These will allow you to see what requirements for meaningful use have not yet been met for this patient encounter. It is generally a good idea to be sure that before the patient leaves a visit, you ensure that there are no meaningful use alerts remaining for this encounter. If a meaningful use alert remains, it is not necessary to return to your note to resolve it. Alerts can be resolved directly from the encounter summary screen. Simply right-click over the alert to see the possible ways to resolve it. Select an option and it will add that information to the patient's chart and resolve the alert from the encounter summary screen. Some alerts cannot be resolved by right-clicking them, but those that cannot will give you an option to go to the part of the patient's chart where you can resolve that alert. You can then click the Close and Return to Encounter Summary button and return to save the data. Click Save and continue to save the information to the patient's chart. If you have not been asked for your password in the last 10 minutes, then the system will ask you to enter your password if you have entered a prescription or an order. To sign a note, click the Sign button in the lower center of the note authoring workspace. Click that button now. You will need to enter your password if it has been more than 10 minutes since you last did so. If you are the person who documented the majority of the note, then you should select Author from the SIG type drop-down box. Select Author now. If you do not require a cosigner on your notes, then you will notice the Make Final checkbox. If you want to finalize the note so that changes cannot be made to it without amending the note, then make sure that that checkbox is checked. Residents and other providers who require co-signatures on their notes will not have the option to check that box because the note is not finalized until your co-signer also signs the note. Click OK to sign the note. Click OK now. Residents and other providers who require co-signers on their notes will notice a co-sign note task that appears after they sign the note. This will allow you to let the supervising attending know that the note is completed and ready for them to sign and finalize. Simply search for the supervising attending's name in the To field and click OK. Once a note has been started on a patient for a visit, you will notice that the N column of the daily schedule displays a piece of paper. Once that note is finalized, the paper in the N column will display with a green check mark over it. This fifth chapter will discuss creating a letter from your note. In this chapter, we will also discuss how to carbon copy your letter to providers and other caregivers. If you wish to create a letter that contains information from your note, you can do so very easily from the note authoring workspace. Click the Letter Greeting section in the table of contents to create a greeting for the letter. You may select a pre-selected greeting by clicking the radio button to the left of either Referral or Consult. You will be able to see the generalized greeting by looking in the note accumulator. The same options are available with radio buttons in the Letter Closing section of the note. You can also choose to free text the greeting or the closing of your note if you wish by clicking on the gray rectangle in the note accumulator and typing. You can choose to carbon copy your note to anyone listed in the patient care team in the patient information section of the chart. After saving your note, in the note output section of the note authoring workspace, click the icon in the CC column and the letter row. You can then choose from the previously loaded patient care team providers or caregivers. When you select a name, it will move to the left side of the screen. Anyone on the left side of the screen will be copied as a recipient of your letter. This concludes video number 3 in the AEHR for Residents series. Please remember that you must watch all of the videos in order and pass a competency to successfully complete this course. The next video in the series is video 4, Tasking and the Work List. This video was brought to you by the Information Technology Education Department at UK Healthcare. For more information, contact the Learning Center at 257-9226.